Question number 1. When does morning sickness usually begin in pregnancy? Correct option is B, at 6 week. Question number 2. Which sign indicates fetal distress during labor? Correct option is D, all changes. Question number 3. What is the most common neonatal infection cause? Correct option is A, bacterial infection. Question number 3. Which nutrient improves immunity in growing children? Correct option is C, vitamins. Question number 5. Which drug used to treat postpartum hemorrhage? Correct option is A, oxytocin drug. Question number 6. What is the most common anemia type in pregnancy? Correct option is A, iron deficiency. Question number 7. Which investigation detects fetal anomalies early pregnancy? Correct option is D, ultrasound scan. Question number 8. What is the most common cause of abortion early pregnancy? Correct option is A, genetic defect. Question number 9. What is the most common cause protein energy malnutrition? Correct option is D, all of the above. Question number 10. What is the most common cause of preterm labor? Correct option is C, infection. Question number 11. Which of the following signs indicate onset of true labor? Correct option is B, regular fan. Question number 12. Which part engagement first in vertex presentation? Correct option is A, head part. Question number 13. What is the most common site vaccine injection in infant? Correct option is C, thigh muscle. Question number 14. Which vaccine given intradermally route commonly? Correct option is A, BCG vaccine. Question number 15. Which sign indicates meningitis in children early? Correct option is D, all of the above signs. Question number 16. What is most common cause febrile seizures in children? Correct option is A, high fever. Question number 17. What is most common cause antepartum hemorrhage? Correct option is C, placenta previa. Question number 18. Which condition increase risk postpartum hemorrhage? Correct option is D, multiple pregnancy. Question number 19. What is the normal duration postpartum period weeks? Correct option is C, 6 weeks. Question number 20. Which condition increases risk of ectopic pregnancy women? Correct option as a tubal infection. Question number 21. What is the first action for unconscious patient? Correct option is C. Cheek airway. Question number 22. Which patient requires immediate isolation? Correct option is A. TB suspected. Question number 23. What type of shark has warm, flushed skin initially? Correct option is A. Septic shark. Question number 24. Which shark shows narrow pulse pressure? Correct option is the hypothalamic shark. Question number 25. What is the first sign of respiratory failure in infant? Correct option is the irritability. Question number 26. Which cardiac disease is most common in pregnancy? Correct option is the maternal stenosis. Question number 27. Which vitamin deficiency causes megaloblastic anemia? Correct option is C. Folic acid. Question number 28. What does positive endorphins test indicate? Correct option is D. Sensitization. Question number 29. What is the most common risk factor for preeclampsia? Correct option is B. Parmigiridava. Question number 30. Which symptoms suggest HELP syndrome? Correct option is D. Epigastric pain. Question number 31. What is the safest antihypertensive in pregnancy? Correct option is C. Nifedipine. Question number 32. Which condition is associated with fully hydromenous? Correct option is A. Anencephaly. Question number 33. What is the main complication of severe anemia in pregnancy? Correct option is B. Heart failure. Question number 34. What is the most common infection causing preterm labor? Correct option is C. UTI. Question number 35. Which drug reduce afterload in heart failure? Correct option is D. AC inhibitors. Question number 36. Which lab value increases in myocardial infarction fast? Correct option is D. Myoglobin. Question number 37. Which medication prevents platelets aggregation? Correct option is A. Aspirin. Question number 38. The drug for hyperkalemia membrane stabilization is? Correct option is D. Calcium gluconate. Question number 39. Which enzyme level is most specific for myocardial injury? Correct option is D. Troponin 1. Question number 40. In acute renal failure, which parameter rises first? Correct option as A. Creatinine. Question number 41. Which condition requires isolation with N95 mask? Correct option as B. Tuberculosis. Question number 42. Which drug is used to reverse benzodiazepine sedation? Correct option as D. Plasmonil. Question number 43. A patient with head injury has unequal pupil. This indicates. Correct option as B. Increased intracranial pressure. Question number 44. Which electrolyte imbalance causes muscle tetany? Correct option as B. Hypocalcemia. Question number 45. Which drug is preferred for rapid sequence intubation sedation? Correct option is A. Midazolam. Question number 46. Which drug reduce intracranial pressure? Correct option is A. Mannitol. Question number 47. Which lab value indicates syphilis progression? Correct option is B. High lactate. Question number 48. Which drug prevents gastric ulcer in critically ill patients? Correct option is D. Pantoprazole. Question number 49. The most common cause of chronic bronchitis is. Correct option is B. Smoking. Question number 50. The drug used for rate control in atrial fibrillation. Correct option is A. Digoxin. Question number 51. The best way to prevent childhood pneumonia is. Correct option is B. Immunization. Question number 52. A mood disorder characterized by elevated mood is. Correct option is A. Mania. Question number 53. Which type of immunity is provided by vaccines? Correct option is A. D. Passive immunity. Question number 54. Which diet is recommended for peptic ulcer disease? Correct option is A. Bland diet. Question number 55. A patient with acute pancreatitis should be positioned. Correct option is C. Polar position. Question number 56. Which sign is positive in upper motor neuron lesion? Correct option is A. Babinski sign. Question number 57. Which layer of the adrenal gland secretes mineralocorticosteroids? Correct option is D. Zona glomerulosa. Question number 58. A burned patient with 30% burns requires fluid calculation by which formula? Correct option is C. Parkland formula. Question number 59. Which electrolyte imbalance causes U wave on ECG? Correct option is A. Hypokalemia. Question number 60. A patient with head injury has Glasgow Coma Scale score of 8. This indicate correct option as C. Severe injury.